Did you know that some of the biggest breakthroughs in medicine did not start with billion-dollar clinical trials or some polished consensus statement? They actually started because one doctor paid attention. That is what is called a case report. A case report is when a physician documents what happened to one patient or maybe a small group of patients, especially when the outcome challenges what medicine thought it knew. Case reports can be the first clue, the first alarm bell, the first sign that something harmful is being missed or some kind of new healing approach actually works. Take thalidomide as an example. Some of you may not know this story, but thalidomide was an anti-nausea drug used in pregnancy that was pulled off the market because it was causing severe deformities in children. And many of these children were born without fully formed limbs. And then in 1961, a doctor named W.G. McBride noticed that these severe birth defects were in babies whose mothers had taken thalidomide during pregnancy. So Dr. McBride just wrote a short letter to The Lancet, one of the most prestigious medical journals at that time, and it was published for his peers to read. That warning helped expose one of the biggest drug disasters in modern history. So what if he hadn't written that letter? Can you even imagine how many more babies would have been affected? And that's just one doctor sharing his observations with his peers. And that's where it started. Now let's talk about another time when doctors documented observations that changed the world. In 1922, there was a 14-year-old boy named Leonard Thompson who was dying from type 1 diabetes. And doctors basically had nothing to offer him because remember, back in the day before insulin, type 1 diabetes was essentially a death sentence. But then some clever doctors in Toronto had the genius idea to treat him with pancreatic extract, which is what eventually became insulin. So this boy's dramatic recovery was documented and published in a case report by his doctors. They published something that happened in just one patient. One patient! And this helped launch one of the most life-saving therapies ever discovered. I have another example, celiac disease. Before people knew much about anything related to celiac, there were these children that were basically wasting away from diarrhea, malnutrition, and failure to grow. But there was this Dutch pediatrician, Dr. Willem Dika, who noticed that when wheat disappeared due to wartime shortages, these children actually improved. But when wheat returned, their symptoms returned. He wrote about this in a series of case reports and a thesis paper, and then he shared it with his peers. That doctor's observation helped define celiac as treatable with a gluten-free diet. And that is why case reports matter. And this is precisely why Documenting Hope continues to publish them. We have published 2 case reports of 3 children reversing their autism diagnosis, and we plan to publish more. When a child improves after removing burdens like inflammation and toxins and infections, and then also supports the body with healthy practices, healthy living, that story should be documented and studied and shared because that's how a medicine evolves. And at Documenting Hope, we believe healing stories deserve scientific attention. So here's my message to all you autism moms and dads. I want you to print out our case reports. They're all on our website. And I want you to march those papers right into your pediatrician's office and ask him or her to partner with you in helping your child become the next recovery. And when they tell you that case reports aren't meaningful, this was just about one child and it doesn't have anything to do with your child, you tell them about the boy with diabetes and the kids with celiac and the thalidomide babies. You tell them. Sometimes the future of medicine begins with one child who got better.